Welcome everybody to our monthly Community Mental Health Transformation webinar. I'm Megan G and I'm the Communications Manager supporting the Community Mental Health Transformation Programme across Sussex. It's great to see you all today, and we have got a jam-packed presentation for you all. Recently, the majority of our webinars have provided an update kind of across the board, what we've been working on as a system kind of across the whole of Sussex. But today we really wanted to provide more of an update about what's been happening locally within our 3 places. So we're going to have updates from a number of presenters from across East Sussex, West Sussex and Brighton and Hove. So there'll hopefully be some interesting information in there based on kind of the areas that you work in, and hopefully maybe some bits that you might want to get involved with, or things that you didn't know had started or were coming up. So we hope that you'll find the session really informative today. But before we kick off, I'm just going to do a little bit of housekeeping just to make sure that we're all settled and able to get the most out of the session. So the webinar today is being recorded, and as always will be added to the YouTube playlist that we have, which hosts all of our previous webinars. So you are able to watch this back, or if you've got colleagues or friends who want to watch it back, you can share the link with them, as it will be publicly available later on in the week. Because it is being recorded, just a note to say that though we do obviously encourage and welcome anyone to have their camera on today, if you would rather not, that's absolutely fine. And equally, if you wanted to anonymise your name, that's absolutely fine. We want people to feel comfortable to participate in whichever way they feel they'd like to today. If you want to turn on any live captions for the session, you can do so by clicking on the 3 dots at the bottom of your screen that says More. And then if you choose captions, you can then turn those on, which will then hopefully help you enjoy the experience more today as well. There will be a Q&A session at the end. So if you do have any questions throughout the presentations today, you've got a few options of how you can submit those. We have got a Q&A box as part of the meeting, so you can put your questions in there and I'll be keeping an eye on those throughout the session. Equally, you can put any questions or comments you have directly into the chat, and we'll obviously keep an eye on those. Or when we come into the Q&A at the end, you can also raise your hand, and we'll then come round to those who've got their hands raised, and you can ask your question directly to the panel. So whichever you want to do, and we'll make sure there's plenty of time for that at the end. And then lastly, at the end of the session, I'll send around an email to everyone who's registered, which will include the link to the recording of the webinars. If you want to watch it again or share it with anyone, please do. There'll also be a link to a very short survey, which we really appreciate if you can complete, because we've been running these webinars for a while now, since November, I think 2022. So it's really helpful for us just to check that they're still obviously helpful and informative for people. And also, if you have any suggestions of topics that you'd like for us to cover in the future, that really, really helps us when we're doing the planning for these sessions. So if you can, please do complete the short survey for us. It's really, really helpful. And then the last thing, as I mentioned, all of our webinars can be watched back. So if you have got a smartphone, you can scan the QR code and it will take you to that playlist. The link to this playlist will also be included in the email that I send round, so don't feel like you have to do it right now. But yeah, that's there, and a really useful resource if you've missed any of the previous sessions. So that's it for our housekeeping. I'm now going to hand over to our first presenter, who is Penny Fenton, who is our Community Pathway Lead for the programme, who's going to provide us with a bit of an update, kind of the Sussex-wide progress to date, before we move into those local updates. So over to you. Thank you, Penny.
Thank you, Megan, and good afternoon, everybody. Just to let people know on the call, I'm in a building I'm not usually in, so it might be a little echoey and my connection might not be great. So we will try our hardest to make sure you can continue to hear me, but we have a contingency plan in case there's a problem. So I just wanted to talk briefly before I hand over to colleagues in East, West and Brighton and Hove, just around what's happening across all of Sussex. Just a little reminder again that we've reached a point where we've described the neighbourhood model that we're wanting to work towards, and that we're starting to think about now how we move to that implementation stage and that implementation phase. And as I say, colleagues will talk much more about that detail in a moment or two. So in order to support some of that work, obviously some more resources needed to go into that. So we've had and been continue to do some model briefing and developing a frequently asked questions pack, a managers pack for all organisations across the system, where we're trying to collect some of those, as it says, most frequently asked and thematic questions that come up, and hopefully for just that little bit of extra resource should people require it, or to aid some of the conversations in the local places that you work. There is also a supporting framework document for the neighbourhood model that which will be presented to their mental health, learning disability and autism board in April, as it says, and also then for use again as a bit of a resource to give the detail that we were asked to work up in the context of a document to help people again think about implementation and use that framework alongside the diagram to help really think about how we be progressing locally. And finally, on that resource pack is as it states that those place-based plans continue to be in development, and those place-based groups continue to meet, and the form of those are changing slightly as we move to implementation. And again, I'm sure there'll be some more updates in the East, West and Brighton and Hove presentations about how those may be happening. I can have the next slide, please, Megan. Thank you. So just to give a little bit more of an update about ongoing engagement, we continue to meet as system leads to continue to think about that clinical and operational structures that may be needed, what sort of resources might we need, what sort of skill sets. So things like, do we need organisational development support? Do we need support around project management? Do we need support? How do we make sure we have the right clinical and operational leadership emerging and to enable us to continue to make local plans? So those things will continue, and we'll continue to check in regularly, and we'll give a further update as we move. One of the things we're thinking about is developing an action learning set for local leads, so we're able to share learning across all of Sussex as well as amongst local teams. Myself and Dr. Oliver Dale have been continuing with our roadshow across Sussex Partnership Trust at this moment in time, and that's why I'm here today at Linwood. And I think we have 2 more teams to visit, and that's really to make sure we're speaking to all of our clinical colleagues to have that conversation about where things are. We're also going out to the emotional wellbeing services, access facilitators, crisis teams, health in mind, and with colleagues developing a voluntary sector pack. We're also meeting with clinical directors. Those things are ongoing. And next week, I think on the 26th, we have an engagement meeting with around 150 GPs out in primary care networks to begin to think about how we develop our model together and present where we're at. Thank you, Megan. Terms of reference around neighbourhood teams and daily huddles that I know areas are starting to think about now are in development. I've had conversations with some of the leads within the system about not just the terms of reference, but how they might map on and what they might replace, and how it's possible to do some of those things. And of course, a lot of that detail will need to be worked out locally, but they've been really helpful conversations, and it'd be useful, I think, for each area to have those broad terms of reference to be able to amend to their for local consideration across their particular area. And as a point 2 refers to that, really, those mapping of existing meetings to think about, actually, we can't add more and more meetings. We need to think about how we amalgamate some of those meetings, and how, as we bring things like emotional wellbeing services, assessment and treatment services closer together, how some of the meetings that exist at the moment merge. That'll be really critical to help us continue to deliver services. As I mentioned previously, we've been meeting with some organisational development practitioners, and they're a group of staff employed by Sussex Partnership that have been trained to host events and work on things like away days, team building, etc., coaching, all of those types of skills. And there are a smaller group out of that group of practitioners that have been working alongside this programme all the way through. We're now pulling together a proposal, really, of the types of things that we may need to help support local plans from an organisational development perspective, and we'll be able to feedback on that in a later webinar and, of course, to place. We continue our work on outcome measures. So all of the national work, bringing that national work together and bringing that work together both within Sussex Partnership and across partners. So starting to have discussions about how do we measure our effectiveness, both from a person's perspective who is utilising the services and from a provision perspective. So is it working well for the person, and how does the organisation know, or the organisations together know what's happening well and what needs further development. So we'll continue to work on that as a system. We've talked about CPA a lot, and it's a frequent question, and rightly so. So I've just hot off a conversation to think about how this really is reborn in the context of a framework very shortly, and we're just about to have a meeting next week to think about how we really restart the framework review work, and at pace, particularly considering the role of the key worker. Again, it's something that comes up very frequently, and how we start to think about the paperwork we use and how we can make sure we have some unification and that we have made it as brief but as effective as possible. We continue to meet with NHS England, and they continue to kind of discuss our progress with us, and that's really helpful. And we continue to learn from other areas. So with further information, and I was talking, myself and colleagues were talking to other colleagues across the country, particularly around the CPA, and we can perhaps have a future webinar across the system about that when we've got a little bit further with it. Community rehabilitation and complex emotional need pathways have got some additional project and leadership support in terms of the programme, which has been really useful. So there's been some further work working with both of those work streams, pulling together their next steps and their pathway documents, etc. And we've had some Sussex-wide workshops, which colleagues have run and been very well attended, where people have started to share where they're getting to, and to really think about best practice and next steps across all of those specific pathways. And we're just about to have a restart, in essence, of the eating disorders pathway group, because it's had a slight delay because there's been some movement in terms of people facilitating that, etc. So that's just a really brief summary of the Sussex-wide things that are happening, and we continue to meet as a team across East Sussex, West Sussex and Brighton and Hove, so we can all support and learn from each other as we progress to developing and delivering against our implementation plans. Oh, apologies. Third slide here around the communications working group, really important, that continues. And as this slide outlines, there continues to be a range of representation within those working groups and within the small groups that have come off the bigger working group. And you'll see Insight Project have identified specific areas for improvement, public-facing comms, engagement with GPs and other professionals, and those task and finish groups have now been set up. So that's really thinking about using all the feedback that we've got and thinking about how we can build that into new models as we deliver. And that last point is a really important one, which is an ongoing discussion about how do we contain an awful lot of information about mental health services across neighbourhoods that's kept up to date and relevant and useful for everybody. And one of those working groups will have a look at how those things develop as time progresses. Thank you. So I'm going to hand over to my colleagues in East Sussex now. If there's any questions, please put them in the chat box or put your hand up. Happy to answer any questions we can, either now or at the end of the session. So for now, thank you very much, and I shall hand over to Ian.
Thank you, Penny, and hello everybody. I'm just going to quickly introduce myself and let my colleagues do the same before going into our presentation around what's been going on in East Sussex over these recent weeks and months. So my name is Ian Dyer. I'm the Programme Manager for Mental Health Integration in East Sussex. I'm employed by East Sussex County Council, but I work across the whole system in East Sussex, helping to support the delivery of the transformation programme here in East. So that's me, and I'll hand over to Becca.
Hiya, I'm Becca, and I'm the PCN Relationship Manager for East Sussex, working with the Emotional Wellbeing Service and then also Community Mental Health Transformation.
Lovely. Hi, I'll go next. Sorry. Hi, I'm Andrea Potter. I'm from the Voluntary Community and Social Enterprise, the BCSE Mental Health Transformation Team, working within East Sussex and Brighton and Hove to help represent the voluntary sector within transformation.
Hi everybody, I'm Richard. I'm an expert by experience, mainly working over in East Sussex, but do some work with the participation team in the centre and with possibility people.
I think, Richard, you're going to start by introducing everyone to the Lived Experience programme in East.
Yeah, sure. So very briefly, obviously there's a continuum of the Lived Experience programme that is kind of headed up across the rest of the partnership by the participation team. And I'm only really involved. I'm supposed to be retired, and why Ian managed to talk me into this today, and other things, and it's great stuff. But much more importantly, I think that this seems to be the technicalities of it in the slides, etc., that are coming. It shows the complexity of all of this, but it's not just about the functions and the systems that have to change. It's something around style and culture. And you know that organisations, businesses, and indeed potentially governments will change because of their style and their culture rather than what they've achieved. And when I first entered the system, some of the stuff was confusing, disappointing, quite weird in some ways, and I didn't know where to access stuff. And now I kind of understand it more. That's only because of some much deeper involvement. So it's really great that on the programme so far, certainly within East Sussex, what I've seen is that it's an equal approach. People have come on board. This includes the voluntary sector, which Andrew will talk about later. But it seemingly that everybody wants this change to happen, and everybody understands why it needs to happen. And we all start off these meetings often with the thing around confidentiality and what you can say and everything else, and this is a safe space to speak, blah blah blah. But I'm not actually sure that helps a lot of people, really. I think sometimes people are still worried about what they say about themselves, about their organisation if they're working as a professional, and so much more importantly, I think that where the magic happens, as is on the slide, is that middle bit where people are also brave. And we've heard people being brave, talking not just about their personal experiences and how that might help to drive change, but also people who work within their own little organisation or their own big organisation who are starting to be prepared to talk about the things that are not quite right within their service. I've never met anybody in my journey through mental health services who hasn't been kind and caring. But they do say, don't they, that the road to hell is paved with good intent. And actually, this is about changing that intent into impact and making sure that service users can access services easily and attain those good outcomes. So yeah, that's it really. And I've seen that in action, and the people that work on the various boards where lived experience has been included are all working within that central space there. Perhaps I can just hand over now to talk about some of that complexity to Andrea.
Okay. Thank you, Richard. That's really helpful. Yeah, so I wanted to talk to Richard's obviously spoken about the fundamental role of the lived experience voice within the transformation. I just wanted to talk very briefly about ensuring that we also have the VCSE voice within the transformation too. So it's obviously essential as we develop and we implement the new neighbourhood team model. So sort of part of my role is to make sure that I am representing the VCSE within the meetings that I attend and those kind of key development central meetings. And I do that kind of ensuring that I am representing the voluntary sector within East Sussex, but I also do that via my role for the VCSE mental health network that we run. So this is a network that we've put together to ensure that voluntary organisations can come together across East Sussex and stay up to date with what's happening within the transformation, but also really have an opportunity to be able to input to that transformation process too. So We meet quarterly. We have quarterly meetings where we update people on what's going on. We also have comms, so we have sort of a monthly newsletter. But we also ensure that where there's opportunity for VCSEs that want to get involved, that they can actually take a more active role as well when they want to. So we will hold sessions where there's kind of key developments, like when we had the model development, we ensured that we had a session with VCSE organisations so that they could have input into that. And also within East Sussex, we also have, as part of the planning and development of the neighbourhood mental health teams, we've got a partnership group as well as a planning group, and we've got VCSE organisations that we've either kind of gone to and asked if they'd like to be part of, or they've kind of volunteered and said they want to have a kind of active role within that. So we've got some of those as part of that partnership meeting too. So they're really involved as we look at what's needed to be able to roll out the new model in East Sussex. And I hand over now back to Richard around some of the work that's taken place so far.
So yeah, this is only a small part, obviously, of the consultation process and the involvement process. But we ran a couple of workshops down in East Sussex, one in Eastbourne, one in Hastings, which were pretty well attended and very well attended, and they were held in neutral spaces, and it was really nice to see people actually being able to, if you like, admit the shortcomings within their own systems and recognizing that to start off with, but also the amount of good ideas that were flowing around that seemingly other people hadn't heard of before was quite amazing. So it's basically just 2 workshops. You can imagine what they look like, but there were 2 key exercises out of it. One was basically how would the neighbourhood team work best in the area, and how would we get to adopt those neighbourhood team principles in your local area? So really it was the who, what, why, where and how of how to do this complex transition, if you like. The defining orange little box is actually, what's it going to look like? You know, what's this thing actually going to look like locally? How are you going to get to access this still? Delivering was really important, is including staff. And I think it's really important that experts by experience particularly are aware of the pressures and the stresses and strains of working within mental health organisations, and they've also got the then addition of another change coming along, and it's that change management that's going to be important. And Penny's outlined some of the really great stuff that's going on so far, and the reaching diverse communities is not a signal or a sign about, you know, how do we include those poor people. This is actually about how do we get, not hard to reach, but how we get specialist access to those groups that most need it. And bearing in mind that East Sussex has got this really strange and growing demographic around older people, myself included, I have to say. And then around awareness is the tricky bit about, in a meaningful way, how do we communicate this to staff to help them make that change, particularly to service users, and what that means in terms of where you go first, and then how you're signposted secondly. And then the greater awareness around the organisations. And again, it sounds like Penny's already briefed us in about what's happening on that broader thing around the clinicians, etc. But overall, I've got to say, you know, the enthusiasm for this change is just there. We've almost cracked it in terms of the momentum behind the change, because everybody wants it. So there should be no excuses for it delaying or not getting to a really effective and efficient service for people who are suffering. But thanks, Andrea. I think I'm handing over to someone else now.
Yes, back to me, sorry. We're just double act at the moment, but thank you. Yeah, thanks for summarising what happened there, Richard, at the workshops. It was really useful. It was really lovely to come together in person as well, to really go into the detail of what that could look like in East Sussex. And what we did sort of following those workshops is we kind of condensed and kind of consolidated all those learnings, all those good ideas, all those suggestions, And when we established the planning group that would drive through the mobilisation of these new teams, and we knew that we'd need a plan of how we're going to actually make it happen, like Richard said. So we've started drawing up the East Sussex specific delivery plan of how we're going to ensure that the neighbourhood teams are established. And we kind of identified 7 kind of priority work streams, or 7 areas that we need to really focus on going forward. You can see those on the right hand side. So the kind of key ones are around kind of the actual implementation of those new teams, what that looks like, what's the resources, what's the time frame, what are the details we're going to need to be able to do that. We also thought about what the work stream around the kind of communication of the change that's coming. We know that's really key, keep people up to date, make sure we are communicating changes to staff, to service users, and to kind of key stakeholders, and make sure we have their engagement as well. So having a kind of comms plan for that. And then we know within East Sussex that we've got a particularly high older adult population. So we knew we wanted to really focus on that and ensure that the new model that we put in place really does meet the needs of older adults within East Sussex too. So we wanted to identify that as a kind of key priority. And then kind of alongside that with work stream 4, really thinking about kind of the health inequalities, the health population within our local area as well, and what that means, and making sure that the model is developed in light of that, and thinking about those kind of key transitions as well. So we know with the new model, we're thinking about ensuring that it's age inclusive, so thinking about kind of younger people as they move into adult services, and again kind of that older adult offer as well would be really key. And then the kind of final work streams, we're thinking about what this might mean in terms of changes around the workforce as we work together in a more integrated way as kind of one team, so involving kind of the voluntary sector as well, and how that feels, and the kind of HR implications too of what that feels like. So Penny mentioned the kind of cultural change as well, and thinking about how we do really make people feel like part of something new and there's kind of one team coming together. And then work stream 6 is thinking about data intelligent outcomes. We want to make sure that the work that we're doing, really is making a difference, and how we might measure that to make sure that we are developing a really effective service going forward, and using that data to drive future changes as well. So having regular reviews so we can make changes to the model as needed. And the final one is just around estates. So we know that as we kind of looking to bring together this new neighbourhood offer, what that might look like in terms of physical spaces for people to come together, what estates we kind of have, and how we can really utilise that. So we do really have a local offer available across East Sussex too. So we've got the beginning of that plan that will be on monday.com for people within the different partnership groups to be able to access and see what we're doing. And we're going to be developing a kind of roadmap we can share as well with people within East Sussex to see when things will start to happen as well. So that's the kind of plan. I'm going to hand over now to Rebecca, who's going to talk to us a little bit more about what that will look like.
Cool, thank you. Yeah, like Andrea mentioned, in East Sussex, we formed a planning group to help drive forward some of the transformation locally. And one of the initial tasks we decided to focus on was defining neighbourhood footprints. So by this, we mean considering the different ways that we might divide the county into their distinct neighbourhood teams. So we've recently developed an options appraisal where we've mapped out the different geographical and demographic information that you can see on the screen there. But we've also taken into consideration the different assets available. So where teams might already be working, what estates might be available where, and how accessible those are. So the next steps for us would be to score these options with stakeholders, and we're hoping to get input from a wide range of stakeholders to grade these different options against a number of factors, including things like implementation and improving patient experience. And then it's hoped that once these neighbourhood footprints have been agreed, we'll have a better understanding of who'll be working together and where they'll be working together. So we can look at practically actioning the work plan that Andrea just outlined and drawing people together into those multidisciplinary teams, and start forming meetings and start to be able to take some more practical steps towards community mental health transformation. And I'll just hand over to Ian now to talk about how to get involved if you would like.
Thanks, Becca. And yeah, I see your message there, Megan. I'll be very, very quick. There's lots of meetings. We've sort of put our governance group structure up there for people to have a look at. All of the meetings that take place to discuss transformation in all its different areas are really open for people to come and join. particularly the Transformation Partnership Group. We really want that to be a really wide, open space for anyone that's interested in participating in the transformation process in East Sussex to come and join the group and be part of the discussion, be able to scrutinise the plans that are being developed by the planning group, contribute to that. And really get a good understanding of what's going on in East Sussex. So if anyone wants to come and join that group, if you're a member of staff working on the front line, if you're working for a VCSE organisation and you're not yet engaged, if you're someone with lived experience and you want to be part of this process, do let me know, and you can definitely be invited to join the meetings. I'll put my email address in the chat. We have the Lived Experience Advisory Group for people that with lived experience that want to help shape mental health services in general in East Sussex as well, and give contact details for how to get involved in that group. And obviously Andrea's mental health network is up and running. If there's people from VCSE organisations that want to get involved in the mental health network, people can get in contact with Andrea around that. So lots of opportunities. If people want to get involved, do just email me and I can get people linked into the right place from there. So I think that's it for me, Sussex. Thank you. Sorry we've overrun a bit. I'll hand over to colleagues in Brighton.
Hello, so I'm Layla Morley. I'm Senior Commissioning Manager for Mental Health in Brighton and Hove, working in NHS Sussex. And I'm joined by Martin. Martin, you want to introduce yourself quickly?
Yep, VCSE Transformation Lead for Brighton.
And also Andrea, who we've already heard from today. So Andrea will be helping us with these slides too, for Brighton. So next slide, please. So Martin's going to start us off just talking through progress to date for Brighton and Hove.
Yeah, thanks, Layla. I'm just conscious of time, so I am going to move quite quickly through this next couple of slides because I think it's probably handing over to Layla in terms of kind of what's the kind of the outputs and what we're currently working on, and then how to get involved from Andrea as well. But the wider programme around community transformation is in phases. Our phase 1 has been underway for the last year, and that's really kind of trying to embed some of the kind of mental health practitioners and support coordinators in our local GP surgeries as well. So we have 4 out of 6 for that, which is really, really kind of positive and really kind of leading that change as well. We had some localized workshops over the course of the last year or so as well. So we've kind of really defined some of the key messages we've taken out around them, thinking about how we're going to promote prevention as a real kind of positive agenda and health promotion as well, but looking at some of how people access services in Brighton, and then how we're going to be working much more kind of closely together in terms of physical space as well. And then thinking about what we're doing well, but also actually where the gaps as well. So we've kind of taken that kind of learning, and we had a kind of another workshop in October of last year as well, and thinking about where we've taken that kind of learning and how we're going to actually kind of mobilize it as well. And then how are we going to be moving forward into that phase 2 again. So that's our next slide, Megan, if that's okay. So as mentioned, kind of our phase 2 is around kind of taking the kind of design of the new neighbourhood models and actually kind of working to actually how do we plan, how do we implement them as well. So what do we need to consider? How do we need to work as well? We're really aware of there's other agendas, there's other things happening across the system as well, and hopefully everybody's heard around the integrated community teams and about their footprint and what their aspirations and what they're trying to achieve. So how do we kind of work really kind of closely, and how do we align as much as we can around those 2 pieces of work as well? So we're not duplicating, we really are building a kind of a strong system for the future as well. And then thinking about Brighton, really, you know, we want that consistency across the whole of Sussex. Well, what's unique to Brighton? What are the services, what are the functions that Brighton really needs to have in their teams? What those population health kind of requirements and ambitions that we're really trying to answer as well. So we've kind of identified some really practical steps as a next forward, and some of those challenges that we've kind of raised as well. But I'll quickly hand over to Leda to think about sort of the most recent workshop, which happened kind of a week or so ago, and then thinking about our outputs and what we're doing next as well.
Thank you, Martin. So we had a workshop, as Martin said, a few weeks ago. We had 27 people from across Brighton and Hove system attend that, which was fantastic. As Martin said, really focusing on how we will implement the neighbourhood mental health teams for Brighton and Hove. If you want to go to the next slide, please, Megan, it just give you a quick overview of the main sort of themes that came out of that workshop. So the first one was really the importance of making sure our neighbourhood mental health teams in Brighton and Hove are aligned to the wider work that's happening around integrated community teams. And the integrated community teams are really based on a very similar principle to the neighbourhood mental health teams, which is great. And it's just an acknowledgement really that our neighbourhood mental health teams in Brighton and Hove will probably form the very first element of the wider integrated community teams. So really about making sure that we have, as it says in the tin, good integrated healthcare, not just for mental health, but for broader physical health, social care, any needs really that an individual might have on a neighbourhood level. And for Brighton, we're really focusing on neighbourhood as being our primary care networks that already exist in the city. So the next sort of key theme is really thinking about the development of the neighbourhood mental health teams. And core to that we felt was really about the culture and the relationships that we're building. So not necessarily focusing just on the functions we want to have within that team or the services we want to align with that team, but really it's about making sure that we've got the right culture and we've got good working relationships across different organisations and people delivering different aspects of care within Brighton and Hove. And we also felt at the workshop that really what we need to do throughout this process is just to remind ourselves of what we're trying to achieve and having that at the forefront of our minds. So really, neighbourhood mental health teams are about providing that simpler navigation for people to be able to know where to go in the mental health system and get support, reducing those boundaries that people often experience between services, where you might find that you bounce around the system a bit and don't sort of get support from any one service, and also providing that holistic care. So again, thinking really about the needs of the individual and having that wraparound support for all of those needs, rather than sort of siloed care. If you want to go to the next slide, please, Megan. So really we discussed the need for having, understandably, and most importantly, the service user voice right up front in what we do in Brighton. So, you know, ultimately what we want to do is improve things for service users. So making sure that we have them involved right from the beginning, but also making sure that we've got a staff voice in there as well, because ultimately they will understand that we work well for the services that they work in and what doesn't work well currently. And that's really going to be how we know that we're getting it right for Brighton and Hove. As I said before, it's going to be about relationship building, particularly thinking about strengthening the relationship between general practice and mental health services, and that's going to be the core sort of foundation that we're going to build upon. I talked about holistic care a moment ago, but really making sure that as part of our core team within the neighbourhood mental health teams, we have a holistic multidisciplinary triage function. So making sure that we have practitioners in that core team who understand and have that detailed knowledge of the mental health system locally, both from a clinical and a non-clinical perspective, because we know that's really important. Making sure that we have a once assessed model. So this concept of only ever having warm handovers rather than relying on a referral process. So that will mean that people, rather than being referred onto a service, we actually pick up the phone, have a conversation, clinician to clinician. Actually, this person will benefit from the support that you provide, and having that conversation, making sure that that person actually lands and has that support from that service, rather than finding that they may get bounced around between different services. And recognising really that even in Brighton and Hove, which is a small geography, we have very different needs and priorities across our primary care network. So making sure that whatever we put in place in Brighton has the flexibility to be able to meet those different needs and priorities, whilst also making sure that we keep the offer equitable, so people don't end up having a bit of a postcode lottery in terms of what support they can access. as you're probably gathering, you know, this is all going to be really complex work, and we've got a really big task ahead of us. So I think what came out loud and clear from the workshop was really actually trying to take some of that complexity out and starting small with some of this. So focusing really on building that core team in our neighbourhood teams in Brighton, and testing out some of that new working, and starting to build those relationships that we want to see across different clinicians and different services. So what we might do is start small with our emotional wellbeing service that are already embedded in some of our primary care networks in Brighton, linking in more with our primary care colleagues in PCNs, and bringing in some core staff from, so our emotional wellbeing service and our assessment and treatment services, to really provide that additional knowledge and support, and potentially sort of looking at things like aligning psychiatrists to our neighbourhood mental health team footprint, and to provide advice and guidance kind of function as well. So those are some of the ideas that essentially we're going to start small, and really develop it in an incremental approach. And we may start with 1 or 2 PCNs and go from there. So next slide, please. So these are just the next steps that we agreed from the workshop. So we are going to have further planning meetings really to think about that phased approach that we're going to take for Brighton, and to work that up further. But in tandem, we're going to establish our new Brighton and Hove operational delivery group, which will really oversee the delivery of the neighbourhood mental health teams. We agreed that we'd actually start from that workshop with sharing knowledge and information. So we're going to start with sharing all of the mental health services currently available, and we have an offer from Sussex Partnership to start doing that, and from the voluntary sector as well. So really helping to share all of that knowledge that we have in the system about what's available for people, and thinking about providing opportunities for people to start getting to know each other and developing those trusting relationships. So we talked about shadowing opportunities, just with one example, and agreeing with our PCNs how best to approach sort of an ongoing dialogue with them. Next slide, please. So I'm going to hand over quickly to Andrea, who's just going to sum up the opportunities for getting involved in Brighton and Hove with this work. Thank you, Andrea.
Thank you, Layla. Yeah, as Layla mentioned, obviously looking to make sure that we have representation going forward from both people with lived experience and from the voluntary sector. So kind of doing that in sort of 2 ways. So as the development of that delivery group is established, we'll think about making sure we've got reps from both of those areas. But we also have, in addition to that, the Brighton and Hove Lived Experience Advisory Group, which is run by Possibility People. So this is an online monthly meeting that they run, encouraging service users to kind of get involved, and ensure that they can have their voice heard as well as we continue to sort of develop the transformation process. Open to anyone that has lived experience in mental health services and lives in Brighton and Hove. And from that, we've obviously got a rep that will be coming to the meetings to make sure that all that feedback is then included within the development of the neighbourhood teams within Brighton and Hove area. And in addition to that, we also have the Brighton and Hove Mental Health Network. So similarly to the network we run in East Sussex, this is again for any voluntary organisation that works kind of directly or indirectly with mental health that can be kind of part of that network. And we ensure that we take out all the developments that are taking place back out to the network and involve and give opportunity for those voluntary partners to get involved in the actual doing as we take that forward. So some of the members there, some of the logos for some of the members that are currently part of that network. And if you are interested in becoming involved, then I'll make sure I share my details as part of this too.
I think we need to hand over to the West, I'm afraid, Andrea.
Yes, sorry, I'm done.
That's okay, sorry to butt in.
Thank you very much. So I'll introduce myself first. My name's Karen Page. I'm the Chief Executive of West Sussex Mind, and I've got a role supporting the transformation. And we're going to talk about West Sussex today. And Amanda, would you like to introduce yourself?
Hello, I'm Amanda Alderman. I'm one of the senior commissioners in the adult mental health team for West Sussex.
So could you go to the next slide, please, Megan? So acknowledging we haven't got much time left, but we'll be quick, but you will get all of these slides out. So just wanted to say there's been a huge amount of work happening in West Sussex around the transformation. Actually, some of that starts quite some time ago. So we've got a slide that just reminds a little bit about the work that's been happening for many years actually in West Sussex around the Pathfinder Alliance, so working between experts by experience, the voluntary sector, Sussex Partnership, PCNs. So there's a link for the website there. Do have a look at that outside of this meeting. I mean, I think one of the real achievements is that the emotional wellbeing service is now live in 20 out of 21 PCNs, and actually that's building on the foundation of really close working with PCNs through the Pathfinder primary care service that started in 2019. So some really, really established relationships that give us a really strong foundation to move forward from. And hopefully many of you involved in West Sussex will know that the County Council are currently leading a public mental health needs analysis that's going to be reporting in April, and that's going to give us some really valuable information for how we kind of move forward through developments. So next slide, please, Megan. So we just wanted to give you a sense of the scale of the work that's been happening in West Sussex. So that's West Sussex and the PCNs there, and just that real partnership achievement of having rolled out that service across that huge geographical area and now being live in 20 out of 21 PCNs. So next slide, please, Megan. So Amanda, over to you.
Sorry, this is going to be really fast, but in West Sussex, we're very proud of what we've achieved so far. We were actually cited in national guidance as good practice for our Pathfinder service. So we're in all of the PCNs, 20 out of 21 PCNs across West Sussex, and we've got a focus on Crawley, where we are having a pilot service up and running. We've done 2 workshops, and people have already spoke about how workshops run and the sort of questions we ask. They've all been co-produced. The one in May, there was about 76 people there, and 30% of those people were people with lived experience or their carers, family and friends. And the voice from that meeting was that there was 3 priorities for Crawley. They want a building, they want help in navigating services more easily, and they want staff to have increased awareness of what other services can offer, and also increased awareness of what mental health presents, like trauma-informed care or mental health first aid for all staff that are client-facing, patient-facing. Next slide, please. So the main message from Crawley, apart from the 3 things they want, was to get on with it. They said, can you just get going, please? And when you get going, keep going, don't stop. They said it doesn't have to be perfect, just have a go and keep us involved. So that's what we've been doing. We have a monthly newsletter that goes out to the people who attended the Crawley workshop. Anyone can sign up, just ask Megan, who's running this webinar today, and she can sign you up for the Crawley newsletter to let you know what's happening in Crawley. Next slide, please. So as I say, we were very fortunate in Crawley to already have our Pathfinder, which we're already working in a transformed way. So this diagram shows some of the things that are happening in Crawley, some of the things we want to happen in Crawley, and some of the things that have started to happen in Crawley. So what we have is our multi-agency triage hub, otherwise known as our MATH daily meeting. So any referrals that are deemed inappropriate for that service, instead of sending back to the person who referred, we send it forward to the daily meeting where there are no rejected referrals, nobody is inappropriate, nobody gets told no. In that daily meeting, we find a solution. And that daily meeting is attended by our voluntary sector partners, as well as our clinical partners as well. And we have links to community services that support those meetings as well. The other thing we have in order to increase staff awareness is the neighbourhood meetings every, I think they're every month or every 6 weeks at the moment in Crawley, and in those meetings we can discuss what other services do and network with other services, but also we can take case studies and ask for support and help with specific case studies in a confidential way. And we also want to introduce the navigation role. We haven't figured out how to do that yet, but what we have decided is that the navigation role isn't just a shared function. It's a person who will be with somebody from the beginning to the end of their journey to support and guide them through services, ensure they get to appointments. We understand not everyone will need that, but that role should be available for people who would like it. At the moment, this is how it's working in Crawley. There's lots of work to do on making it a bit more seamless, a bit more joined up, making sure everybody's involved. And this is the ambition, is the next slide, that we have one team, one community mental health team. It's referred in, either you can self-refer It doesn't really matter who refers, anyone can refer in, and there will be no inappropriate referrals. Everybody will be welcomed into the team with support, and we will find an option for everybody who's referred into the team through multidisciplinary teamwork. And we'll also have the navigation role for those who need it. Thank you. Next slide. I think actually we might end it there. West Sussex have moved into phase 2, and I know others have also talked about what they're doing in their phase 2. We have lots of meetings and conversations ongoing. Do you want to just finish off, Karen, by explaining what's happening in phase 2?
Yeah, that'd be lovely. Thank you. So perhaps, Megan, if you could skip through the next few slides and we'll just get to the one after that, I think, please, the next step slide. So what you'll see when you get the slides through is we had a workshop very similar, and you'll see some of the themes and the discussions that came through, but we're in a similar place, I guess, to Brighton and East Sussex in terms of working together really collaboratively to find a way forward, but making sure it's really relevant to West Sussex, which is obviously quite a different geography and different demographics. So we're establishing a shared leadership team at the moment, and that's a partnership between the NHS and the voluntary sector. And we'll also be looking to involve other people in that in terms of experts by experience. There's some work to do, as others have said, to really define those neighbourhood teams and the footprint, and that's a real urgent priority for us. And then we'll be drawing up a mobilisation plan, and again, mirroring some of what's been discussed for Brighton and East Sussex, and there'll be some task and finish groups. So you can see those 3 ticks at the bottom of the things we really want to get right first: clear meeting structures, engaging more broadly, and also agreeing those neighbourhood footprints. And I think the last slide has got the opportunities to get involved, and I see Jenny's already put something in the chat about that, which is great, but please do get in contact if you'd like to join the Lived Experience Advisory Group or the Voluntary Sector Mental Health Network, and you've got the links there on the slides. So thank you very much.
Thank you so much to all our presenters. I know that was a bit of a whistle-stop tour. I'm sorry that it all became a bit rushed at the end, but as Karen and Amanda said, you will receive all of the slides, so do feel free to obviously read them through in your own pace at your leisure. And if you do have any further questions after the webinar has ended, do obviously feel free to get in touch with myself or any of the other presenters on the webinar today, and we'll be able to obviously speak with you further. But we're now going to move into the Q&A section of the session. We have had a couple of questions come into the Q&A box. So what I'll do is I'll read those out, and then our presenters, if you're able to jump in and respond. So for East Sussex, there was a question that said, are we able to have sight of the delivery plan that's been developed? And also, how can people get involved with the work streams so that we can ensure that there's correct representation within each of them?
Shall I come in on that one? Like I say, I think the easiest way to start a discussion around involvement is if people want to email me, as I tend to be fairly linked into most of the programme work streams in East Sussex, so I can definitely get people linked into where they want to be. I put my email in the chat earlier on. It's ian.dyer@eastsussex.gov.uk. So yeah, please do feel free to email me. We're really keen to get as much input into all of our discussions and planning processes as we can from as many different fields and arenas and individuals as possible. So yeah, really would welcome people to get in touch with me to get involved. In terms of the delivery plan, I think so. I mean, it's as Andrew said, it's on monday.com as far as we've got at the minute. Maybe I actually ask Andrew if, in terms of getting stuff off of monday.com and putting it into a format that we can share and present, I guess that must be doable.
Yeah, definitely. And I've just spoken actually about kind of giving access to the wider planning group to make sure they can have access to see it. And as I mentioned earlier, we're looking to develop a kind of visual roadmap to show the main stages and timeframes as well. So we can definitely share that back as well, that will have kind of the main points that we're aiming for, we can share with you.
And how would we do that? Do we do that through this? Do we do that through you, Megan, or how do we get things sent out to everybody here?
Yeah, so we can get them added to the community transformation page that we've got on the ICB website. We've also got the newsletter, which we circulate things around, but also we can send that round as part of the distribution for people who register for the webinars. So yeah, we can absolutely circulate that.
Thanks.
Thank you both. There was also a question around the resources that have been developed to support the neighbourhood model, and again those will be made available via those channels. We're just going through a sign-off process around the framework document and the final model diagram, which we anticipate to be completed in April. So once that's been done, we'll then obviously share with obviously the distribution list that we just mentioned, to make sure that everyone's got those available. So yeah, they'll be coming soon. I think they were the only questions that we had in the Q&A box to start off with. Oh, here we go. So question for Penny. Would be interesting to hear how the briefings and the conversations that you've been having with staff are being received. How have they been going? Be helpful to have a bit of an update.
Yeah, no problem. So they've been going really well. People have been very engaged in discussion. There's the very real and concern about how do you continue to deliver and change. So there's been lots of conversations about that and some discussions around how we can help with that in terms of organisational development support. There's been a lot of discussion around how you kind of really localise the framework. So that's been really helpful, and people starting to already start to think about, oh yeah, I've got a meeting that looks a little bit like that. I wonder if we could convert that into something that you might be suggesting. So people really thinking about building those partnerships and how they might start to have a think about some of those things. There's been no kind of pushback in essence around the approach and the thought of neighbourhood teams. In fact, the opposite. People are quite excited about thinking about how they bring things together and work together more effectively. But yeah, so I say that's the good thing. I think we're pushing on open doors in the context of putting the model together for each place. But as I say, the thing we need to work through now is really making sure our teams are supported to both be really involved in the development of what happens locally within teams, and really develop to think about that cultural spot that I think Andrea referenced earlier and I talked about at the beginning. How do we really, really start to feel like in a place, in a neighbourhood, we're one team? And I think that needs a real focus this year, which we're obviously thinking about as we move together with the plans. But overall, I would say, I haven't been anywhere where there's an awful no way response at all. So lots of enthusiasm, and then just a bit of a plea for people to be able to do things at pace and in an organised way, which is starting to happen through the neighbourhood plans.
Thank you, Penny. That's really helpful. We're just coming into our last minute, so I don't know if anyone has any final questions or whether we should wrap up. Okay, I think that's everything. So thank you so much to all of our presenters who've shared obviously some really helpful updates with us all today. As we said, we will send around the slides, so do obviously have a look through those, because I know we did have to rush through some of them towards the end, so apologies for that. Thank you all so much for registering and for attending today. I hope that you found it useful. If you do have any further questions or comments, please do feel free to get in touch with myself, and I'll be very happy to speak with you. We'll be back for our next webinar on Wednesday, the 17th of April at 12 o'clock. So please do sign up for that. You're also now able to sign up for all of our future dates that we've got until early next year. So if you want to get those in the diary ahead of time, please do feel free to do so. But yes, just thank you again for your time and for your contributions, and we look forward to seeing you all again soon. Thank you so much.
Thank you.
Bye-bye.
Bye-bye.